My name is Doral Fredericks, and I am the Global VP of Medical Affairs and Outcomes Research at Organon. I think fundamentally, one of the things is just for clinicians to recognize that this is real and just not to dismiss patient complaints about worsening symptoms or differing symptoms, because patients, they've stated they feel unheard when it comes to these types of changes in their system. And I mean, we know that hormonal shifts, do cause a lot of predictable skin changes, but they're attributing things to just natural hormone changes or aging. So just to not be dismissive, I think, is a really important piece, and actually reassessing the symptoms, understanding what is worsening. Is it associated with something like joint pain, fatigue, or other symptoms? Or interfering with sleep or daily function, and then delving down into that more. I mean, unfortunately, it's hard because we have a healthcare system that doesn't allow for a lot of time with patients to really go down deeply, but those conversations are incredibly important. I do think on the side of the patients, however, they need to be advocates for themselves too. And again, not just assume that these changes are, hormones, and I'm not going to worry about it. Like, have the dialogue and do some education. I do think that also specialists, and in this case, like dermatologists, can better collaborate with other specialties. So, I always say collaborative medicine, and I truly believe collaborative medicine is the best kind of medicine. And so dermatologists can really support, I think, women far more holistically if they work with other specialties like OBGYNs, like endocrinologists, and learn from each other about these life stages and these rapid hormonal shifts, immune changes, and like mental health stressors that are happening, because that just more holistically helps, I think, treat patients in an overall better way during this evolving medical need time. Certainly, dermatologists are the primary treaters of skin diseases, right? And so a lot of patients, even if they're generally seeing a primary care physician, certainly during pregnancy or in menopause, will be referred out to OBGYNs and endocrinologists for various reasons. So again, I think having those tight relationships with those particular specialists can be really helpful in just the dialogue and education of each other. So that's number one. You brought up a really interesting point about, the mental health stigma, and we can certainly talk more about that. But psychiatrists or psychologists are a really important piece of this, because we know that skin diseases have a really high correlation with a number of mental health issues throughout the course of life. And so that's another specialty that is really, really important to engage when necessary.
Absolutely. Dermatology is so visual. I feel like it's a very visual disease. Everybody is going to see it and you're going to be self-conscious about it. So I feel like whenever I get to talk to patients and they tell me about their success with therapy and with psychology and getting to feel more comfortable in their skin, I think is super, super important.
Yep.
For a woman who has a chronic skin condition or a poorly managed skin condition that's affecting their mental health, their sleep, their overall quality of life during these transitions. What impact can that have on them, on themselves and on their mental health?
Oh, I think this is such an important question, and something that, again, I overall, I'd say our medical system doesn't necessarily always think about. And that's a generalization, but it is a really key point and important, specifically for chronic skin diseases that aren't well controlled during some of these hormonal transitions. There's a lot of literature out there to support that it can worsen things like anxiety. I mean, you mentioned this: anxiety, depression, sleep quality, sexual well-being, self-esteem, and just overall daily functioning. And these effects are real, measurable, and often, underdiagnosed or even misdiagnosed. And for example, depression in this context can lead to some really significant downstream health risks, including stroke, heart attack, and even death from cardiovascular disease. So it's something that we absolutely can't ignore. And even if we're not talking about something as major as a cardiovascular issue, I'll share with you a story of just a patient that we had in a clinical study who had psoriasis, and she shared this. She went to get her hair cut and styled for her son's wedding, and she went to the stylist, and she had some psoriatic lesions on her scalp. And the stylist, when she saw those, refused to work on her because there was an assumption that the psoriatic lesions were somehow contagious. And I just go back and like, how do you think this person felt? On one of the most important days of their life to this point, and is left with this feeling of being somehow unworthy. And I think it's just really heartbreaking and honestly unacceptable. And I think it really underlines the need for education as a whole about dermatologic diseases and how they impact patients in different ways, but it can have profound effect on their life.